And as more people are getting vaccinated against COVID-19, some health experts, they are concerned vaccines are not reaching the most vulnerable in the Asian American and Pacific Islander community. Our ABC 10 News reporter Melissa Messiha spoke to one doctor about how recent incidents against the AAPI community may play a role.
Vaccine eligibility will open to all adults mid-April. With recent events in the Asian American community, some are worried about those eligible now.
We're concerned that a lot of the elderly Asian Americans are fearful of recent waves of anti-Asian violence and racism.
Dr. Maria Rosario Araneta said that could be why some aren't leaving home to get a vaccine. She said they're seeing that in the Bay Area.
Vaccination at the Moscone Center, which is their super vaccination site, seems to be missing, specifically elderly Chinese. My sister works in Oakland, Chinatown. She's had so many elderly Chinese cancel their medical appointments.
Dr. Araneta is with UC San Diego School of Medicine. She's the Assistant Dean of Diversity and Community Partnerships. County data shows for those 65 and older who received one dose, the Black community has the lowest rate. Next is Asian and Pacific Islander at 55%. In February, ABC 10 News shared the Black Nurses Association was partnering with local churches to hold vaccination events. Dr. Araneta said in the AAPI community, language is a huge barrier.
Among the AAPI communities, that's multiple languages. So not knowing which languages are urgently essential for intentional outreach becomes critical in prevention efforts.
She also said with Asians in one category, it's hard to see which communities need more outreach. That information can be useful for COVID and other future outbreaks.
How are we going to be able to discern whether it's in the Filipino or Vietnamese or Karen community? And how will we know which communities to intentionally and rapidly target?
Throughout the day Monday, UCSD Health provided vaccines to refugee and asylum-seeking communities, including the Karen community, Somali, and Vietnamese.
We have the tools to target certain neighborhoods. We just need to know who and where.
Melissa Messiha, ABC 10 News.
A county spokesperson said the data is tracked using categories set by the CDC and the state public health department. She added that California hospital systems don't include the different Asian ethnicities in the information reported to the county.